In an ADHD brain, a thought can immediately transform into an impulse and an action. Now with medication, maybe you have just an extra moment to stop and think. So the first thing that you need to do, if the medication turns on your mind, we need to start there. You need every bit of positivity you can muster because things happen quickly, suddenly, and unexpectedly with ADHD. Social science teaches us if we continue to experience pain and we don't understand where it's coming from, our nervous system shuts down. That's called learned helplessness, and it's pretty much a nail in the coffin for ADHD behavior change. This could be the last chance that you get at changing your behavior. It's very important that you don't set out on this mission of habit formation too early. So we want to think about how you think, and most importantly, what you think and when. We're getting an inventory on those automatic thoughts that show up every single time. These are called cognitive distortions. And with ADHD, there's something that you're especially prone to. Are you being nice to yourself? Now let's talk about what happens at the checkout counter. All or nothing thinking. Seeing things in black and white, either perfect or a total failure, no in between. Overgeneralization. One bad event becomes, I always mess this up. Catastrophizing, always jumping to the worst case scenario. Should statements, I should have or I must. Putting impossible pressure on yourself. Labeling, I'm bad at this instead of I'm just struggling with this right now. Emotional reasoning, I feel bad, therefore something bad must be happening. Okay, so what does this actually look like? I'm gonna break down 3 thoughts that I hear consistently from my patients and give you a look at what is actually happening here. Thought number 1, I guess I'm not good enough. See what's going on here? You're defining yourself as not good enough. Not your behavior, not the situation, you as a person. That's labeling. It's also overgeneralization. One failure is permanent inadequacy. You're either good at something or you're not. No gray area. The reframe, I am struggling with this thing. That doesn't define who I am. Thought number 2, I'm really bad at that. Again, labeling, I am bad. Instead of I'm learning or I'm struggling right now. Overgeneralization, I am bad based at what? A couple of attempts. All or nothing, good, bad, nothing in between. Reframe, I haven't mastered this yet. I am building the skill. Thought number 3, should have just pulled up my bootstraps. That's a should statement. Creating guilt and shame for not meeting an impossible standard. It's also perfectionism. The idea that you could have just tried harder. Ignoring every other factor. And it's minimization. You're minimizing the reality of ADHD, executive function challenges, and whatever else is going on. And here's the reframe. I did what I could with what I had at the time. What can I do differently next time? When you want to do a task, call the dentist office, check your email, whatever it is. You think, okay, let's do it. And then your brain goes, I don't want to, I don't need to, let's do it later. And then later comes and you don't do it and you're frustrated. What happens? You yell at your child and you lose your temper just because you waited too long to do your email. At 11 o'clock, you should be in bed mentally preparing for the next day, not looking at a bunch of TikTok reels. This is where the ADHD focus formula comes in. Step 1, plan. Step 2, initiate. Step 3, reflect. You wanted to do the thing. Okay, how are you gonna do it? Now it's time to initiate the plan. And what happens? Not long after the first I'll do it later, you should start being real with yourself. Can you actually do it right now? If no, give yourself a get out of jail free card. Just don't do it today. Instead, ask yourself what went well, what didn't, what can I do differently next time? Then break it down smaller and do it earlier. Repeat this process and eventually you will do the thing. Now that's lining up expectations with reality. Along the way, you're problem solving. And this problem solving is your path toward a sustainable, repeatable, predictable process. You're building cognitive flexibility every time you keep your mind open. Open to the possibility, open to change, open to how you actually feel. When you do that, you've built the habit of problem solving. So those negative thoughts, they just can't seem to stop. That's okay. I got your habit priority. And good news, you don't need to do it for 21 days. Just 1 week. I've got a week of gratitude prompts. Wake up and do it first thing in the morning. We're not talking paragraphs, we're talking 1 sentence, even 1 word. If you do this 7 days in a row, you'll naturally become able to reframe negative thoughts throughout the entire day. And trust me on this, the weight of the world gets a whole lot lighter when you know the power of cognitive restructuring. You really can do anything. We know this because I talked about it in the beginning of the series when I had to respond to Hada ADHD and remind her that consistency is possible. We're just using the behavioral science and the age of information that we know is true to hack your behavior. If you want those gratitude prompts, I get that and a few more resources all for free. Sign up for my email list, link in the description. And if you haven't heard, ADHD now officially makes sense. Just check out my video right there. Drop a comment. What's your biggest cognitive distortion? What shows up at your checkout counter every single time? And go ahead and hit subscribe if you want to keep receiving practical strategies from a nurse practitioner that won't sell you short.